So today we have with us Dr. Devon Mallard. She is the Hospice Medical Director for Applegate Home Care and Hospice. Thank you so much for being with us today.
Thank you.
So today the purpose of this video, more than anything, is to help dispel the myth with hospice care and pain medication. There's a lot of people that have this concern that their loved one is just going to get on hospice care and just be drugged up. And we want to help shed some light on that and shed some clarification. So the first question is really, what is the myth as it comes to hospice care and pain medication?
Yeah, I definitely think there's a myth or a common misconception about hospice that immediately upon enrolling in hospice, you receive medications for pain that hasten your death. And that is, obviously very much not what we do. We are dealing with very serious illnesses, and a lot of symptom management happens on hospice. So patients may have, severe pain, may have shortness of breath, anxiety are very common things to experience at the end of life and for patients on hospice. And so we do use a lot of medications when appropriate for patients who have those symptoms. We certainly never give them just because, it's always to treat a symptom. We're always using the lowest dose that gives us the effect that we want or that the patient wants, It's very patient driven. If a patient would, prefer to avoid medications and would prefer to, have XYZ symptom rather than having medications, then by all means, that's their choice. And so, and then the flip side is true too, that the patient might say, it's not acceptable for me to live in this kind of pain anymore, and please, change my medications around and get me more comfortable. And then we can, work with that as well. So definitely the myth is that that your life may be shortened if you go on hospice because you might get sort of too many pain medications. The studies show that the opposite is actually true. People who sign up with hospice actually usually live a little bit longer. And one of the great things about hospice is that it's a multidisciplinary approach, meaning you have a chaplain, a social worker, you have your nurse, your aides, your doctors, and we're looking at you as a whole person. And so we understand that your, spiritual distress or your distress over leaving your loved ones may be contributing to your symptoms of pain and anxiety. And so we have your chaplain and your social worker and your nurse who can work through all of that. And then we can kind of tease out what's really physical and what we need, to treat with medications. Hospice providers are very keyed in on understanding that patients are multifaceted and that, we have many, many things going on at this phase in life. Certainly we use medications as needed. We always use the lowest dose that, works to help alleviate your symptoms. But there is so much more that hospice does than just give pain medications. So hopefully this can help dispel that myth.
Perfect. Thank you so much, Dr. Mallard.
Yeah.